Welcome to the Shrewsbury and Telford Hospital NHS Trust webinar series. This inaugural webinar will tell the story of our learning journey through our partnership with Virginia Mason in Seattle, Washington in the United States. My name is Rachel Hanmer. I'm a member of the Kaizen Promotion Office here at Shrewsbury and Telford, and I'm pleased to be able to introduce our presenter today, Nick Holding. Nick is a senior specialist in the Kaizen Promotion Office at the Shrewsbury and Telford Hospital NHS Trust. He has over 10 years' experience in leading improvement and transformation and trains leaders in effectively practicing the use of lean tools, methodology and developing lean culture. Prior to joining the NHS, Nick had developed a career in the hotel and catering industry, undertaking management roles in several large hotels across the country. This is where he established a passion for great customer care, which he has now taken forward into healthcare. Nick specialises in the psychology of change, lean culture, improvement through coaching, and leading change using social movement principles. Today's session will be recorded and posted on the SATH website. In addition, we will tweet the YouTube link from our @SATHKPO Twitter account. Nick will also be hosting a live tweet chat on Thursday the 22nd of June at 3 p.m, where you will be able to ask any questions raised from today's presentation. Thank you for joining us today. I will now like to hand you over to Nick to begin the webinar. Introduction to our learning journey.
Thank you, Rachel. So for this webinar, our first one, we'd like to share with you the story of our journey so far of our partnership with Virginia Mason Institute. I want to be able to highlight some of our areas of improvement and successes and share with you some of our opportunities for learning. I want to discuss a bit later on about how we've engaged our teams, and then we'll finish off with a few next steps. So we are a medium-sized acute hospital serving a population of around 500,000 people across Telford and Wrekin, Shropshire and Mid Wales. We see just over 120,000 ED attendees and over 400,000 outpatients a year, being cared for by over 5,500 staff across our sites in Telford, Shrewsbury and MLUs across the county. Here's a little bit more about our story.
The Shrewsbury and Telford Hospital NHS Trust is on a mission to deliver the safest and kindest care in the world. In fact, we want to have our population be the healthiest 500,000 people on the planet. And that means improvement across 4 strands. Values in practice, leadership through transformation, vision of our future, and promoting health and well-being. We want to evolve into a leading healthcare organisation delivering top-level care, building on our foundation to become an exemplary healthcare organisation. To achieve our mission, we're partnering with the Virginia Mason Institute, which provides education and training based on the work of Virginia Mason, named Top Hospital of the Decade in America. With our Leadership Academy, we are developing techniques which place quality, kindness, safety and patient experience at the forefront of what we do, fitting in with our core values of creating a safe, caring and respectful environment to work and be cared for. The partnership with the Virginia Mason Institute gives our staff the tools to make changes and improve care for patients whilst getting the best value from our resources. It provides training and certification, and over time we'll be able to train our own staff on the new techniques, creating a sustainable culture of improvement through our Transforming Care Institute in partnership with the Virginia Mason Institute. This isn't about a top-down process. It's about evolving as a trust together to find best practice techniques that staff can share with one another. Together, we will achieve great things and play a key role within the communities we serve, providing the kindest and safest possible care.
It's hard to believe actually that this programme is almost 2 years old, having been awarded the contract in 2015. So that was following quite a successful bid to NHSI, who was previously known as the TDA, the Trust Development Authority at that point, where I think over 68 trusts applied for this partnership with Virginia Mason, and we were fortunate enough to be awarded it. So around about September 2015, we formally began our partnership with VM, and we created our Transforming Care production system, and so develop that through the Kaizen Promotion Office. So this the Kaizen Promotion Office is essentially the team who are working with Virginia Mason to help support the rollout of this training and learning across our organisation. At the same time, we launched our organisational strategy, which you can see here on the left hand side. This is underpinned by our SATH values, which are already embedded across the organisation. So we felt this was really important to keep these on board. These values were created and developed with the staff, and they were well known across the organisation already. So these are really easy to underpin these as our organisational strategy. Then through the organisation, through the strategy to the top, where you've got the patient and the family at the very top of everything that we do. And this is really fundamental. This is a key part of everything that we do now. Really focusing on the patient. Are our processes, are our systems set up for our patients and their family? Is it adding value from the patient's perspective? So these are constantly these questions that we're asking ourselves. Shortly after this, we launched our Transforming Care Institute, which is essentially the hub or the umbrella facility for all improvement work within the organisation. And this really helps us to drive the work forward. This is the link between the Virginia Mason Institute in Seattle, in America, and us. And it's the central hub where all the work comes through. It's also a physical space where staff from the organisation can come and use as a training facility, and also to come to ask for advice and guidance. We're soon launching the Leadership Academy, which places the organisational development work, the OD work, really squarely alongside our Transforming Care production system work as well. Because this is really about developing our teams and about our organisation. This is not about delivering projects or initiatives. This is staff development, team development, and organisational development programme. This really does link in with our values in practice agreements. These are our sort of compacts, our agreements that we have with our teams. And these are the sort of give and gets that we've agreed as an organisation that we will do in response for a certain commitment and behaviour from our teams. At the moment, this is to our senior leaders and to our medical teams, but this will I'm sure spread out to all staff across the organisation. So the work really does need to be self-sustaining. It can't be seen as a project or an initiative. It has to be seen as the work, as is said so often. So you can see from this graphic here, we have an incremental programme of work which really focuses on engaging and educating our teams and our staff across the trust. So we've set some quite ambitious targets to hit that, and you can see by the end of year 5 we'll aim to have educated at least 5,000 staff in our organisation on the Transforming Care production system, and have over 1,000 staff actually actively using the tools and the techniques that we are teaching. We believe after 5 years we'll be in a position where we can self-sustain. We'll be able to stand on our own 2 feet. That's where our partnership with Virginia Mason officially ends, and we'll be in a position where we have learned enough and we'll have embedded enough to be self-sustaining. By no means at this point do we believe that we will have done it. Absolutely not at this point at all. We know that it's taken Virginia Mason 15 years to get to this point, and they're still learning. So we know it's going to take a long time, but we believe after 5 years we're in a position where we can go it alone potentially. And I think one of the things that really does support that is the guiding team, the establishment of the guiding team, which is sort of the programme board for this work. Lots of people ask me why is this different? Why is this different to anything else we've done before? I've been here for 15 years now, and there is fundamentally something different about this piece of work, and I believe it's the guiding team. I think having that organisational commitment at the very senior level across the board, across all of the board, or across all of the trust board and the executive team, is a really powerful message for everybody in the organisation to say there's a real commitment to this, and we do believe in it. So you can see every member of the executive team is on the list, including a non-executive director. We have Kathy Smith, our KPO lead, support from NHSI representative, and very well supported by our executive sensei from Virginia Mason, Deborah Dallard, who sits in with every monthly meeting that we have. And this team really does take the reports and steers the work, provides guidance and direction on where we need to go next. Often challenge on if we need to go push further or push harder, but also some root cause analysis as well, where we find that work isn't embedding as it should be. So Transforming Care Institute is something that we set up as a hub, as I said before, as a hub and a resource for the organisation. It's a physical space at Shrewsbury at the moment, and will be rolled out to Princess Royal shortly. And it enables staff to come down and use the space for learning and for support and for coaching, if need be, in how they would want to deliver their Transforming Care production system in their areas. So our purpose really is to coach and facilitate teams, not to lead or to manage projects on behalf of the organisation. We coach others and facilitate teams in delivering their own improvement works, however big or small that may be. So what we really want to get to, that place we want to get to, our vision is where, as a trust, we are that resource for the deployment of the Transforming Care production system, where people come to us for advice and guidance on how they can implement change or transformation in their own areas. As I said before, they know the work, they know their improvements, they know what works for their patients. So we should believe in them to get on with that improvement with our support and our guidance. And I often equate this to something like, if you had a finance query, you go to finance. If you had a HR query, you go to HR. So now what you have, teams across the organisation have a resource available to them. If they want to make a change, they want to deliver transformation in their own area, they have a resource they can go to. And we'll also be facilitating wider work as well. And really that is so our longer term mission is to transform healthcare within our organisation with this structured approach, this proven structured approach to improvement work, which is one consistent method of doing that. And that really is based on a number of key principles drawn absolutely from the genesis back to Toyota. Toyota developed their production system. Virginia Mason translated that into healthcare and created their Virginia Mason production system, and now we're translating that into the NHS, into Shropshire, and created the Transforming Care production system. And this is based around a number of things. Our partnership with the other organisation is really strong and a really key part of this work. So we have our learning partnership with Virginia Mason, but also with the other 5 trusts as well across the country. Our leadership through our organisation really supporting the development of the production system, and from our work through our training and our facilitation with teams and with individuals across the trust to help them support to deliver improvement work themselves. Based on a number of key issues around huddles, those rapid resolution of problems, 5S, that organisational strategy around workforce organisation. You've got standard work, that consistency of methodology, taking what's not just my opinion or your opinion, what's the right way of doing things. Standard work helps to build that safety culture, a real consistent quality methodology. Where we find where we don't have standard work, there is an inherent risk of defects or mistakes happening. And Gemba Walks really support that. Gemba meaning the place where the work happens, where the value is created for our customers, our patients. So Gemba Walks go into the place where the work happens, really truly seeing for yourself what happened, not basing judgments on management reports or audits that have been taken 4 to 6 weeks previously. This is actually going to the Gemba to talk to staff, to listen, to see, to understand what's going well for the teams, what could be supported, what needs more help to unblock those blockages that we find. So Gemba Walks a really important part of that. Report outs, which are happening regularly, support the sharing of the work and helping to resolve problems. And Kaizen events really do get down to the root cause of those problems and help to lead those workshops to actually pick up on if there's a key problem, deliver the Kaizen event, which will focus on identifying lots and lots of ideas and solutions generated by the team, and then help them we'll facilitate them to actually put those into place. So our Kaizen events and workshops that we run are just one way of really engaging and supporting our teams to develop the improvement work across their own areas. So we have a number of other ways we do that. So we are really focused on, as you saw from the graphic earlier, some of our targets that we have are around our engagement and education of our teams. We're well on track to hitting our 2,000 for this year. You'll see there we're just under 2,000 now. So we feel quite confident that we'll be able to do that year on year. And the engaged one really is staff who are actively using the tools. So this could have been through a training session, and as a result of the training session they then go on and use the learning of these tools and the methodology which they've picked up. It could be through the Rapid Process Improvement Workshops, the RPIWs, through our Lean for Leaders, which we will touch on a bit later on, and through our value stream sponsor teams. It could also be through we're rolling out a program of 5S Works. This is people who are actively using those tools on a day-to-day basis to make small improvements or larger improvements in their own areas. And this brings us on to our value streams, our key priorities for the organisation. So this is the piece of work which really sort of starts off. This is our foundation for the word, those key priorities. And the way these were identified was through a program of consultation with the organisation, where we started to ask the question of our teams, what should we be focused on? Clearly there were some organisational priorities anyway. There were some things that we needed to focus on, but we wanted to go out to the teams to start to develop those. And through the guidance team, those were worked through, and we identified our 4 key areas to start off with, which we continued later on. So those are our four key value streams at the moment we're working on, and these are just our pillars of work, and there's lots of other things going on alongside this. But our 4 key areas are respiratory discharge. So this is from when a patient arrives on our AMU to the point when they've received all elements of their care within South. Then we have our sepsis pathway, which is from when the patient presents in our emergency areas or on our wards presenting signs and symptoms of sepsis to the point when all elements of their bundle is completed. We have recruitment, and this is from when a vacancy is identified to when a member of staff begins work. And then ophthalmology outpatients, this is from when a referral is first received into our organisation to when the patient has their first outpatient consultation. So these value streams are our structured piece of work that we have lots of rapid process improvement workshops being delivered on. And value streams essentially are a process, an end-to-end process which describes the patient's journey. It could be a cross-cutting a number of teams and departments, a number of directorates or care groups, which is why they're called value streams from the perspective of the patient. They go across multiple areas, and that's where our focus is. We're not focused on particularly within a care group or particular directorate. We're looking at the value stream of the patient or the customer in the case of the internal recruitment, where the customer would be the candidate. So this ended up being our first full piece of work. And we've been working on these now, for some cases, discharge and sepsis now for over 12 months, and we've seen some really great improvements in those works. Recruitment and ophthalmology outpatients are a little shorter in their work, and we've already seen some great early results. So these were initially selected by the value stream, sponsored by the guiding team, and then future value streams will be selected based on organisational priorities and suggestions from teams. I think we really will see more of almost like a bidding process now, where we're already getting suggestions from across the organisation of people wanting to come putting their ideas forward, such as things like diabetes and cancer pathway, end of life care, procurement, supply chain, that sort of thing. So I think there's lots of opportunities out there. People are already suggesting where we should go next once the next round of value streams are selected. So a bit of detail behind some of the value streams that we've done so far. So respiratory was our first, and what we've seen is some great improvements across that pathway. Focused mainly on our AMUs across both sites and 2 respiratory wards across both sites. What we've seen is a real reduction in the time it takes to get that assessment. And do we admit the patient or discharge? That it was taking quite some time, 204 minutes, to get a decision to admit or to send home, and that's a patient who sat in our AMU department waiting for that to happen. We saw a significant reduction on one of our wards in just that time it takes for a patient to know what's happening with them from when they arrive on the ward. And that's just really simply about how we can communicate quickly to let patients know their plan of care and when we think that they'll be going home. This supports them to make their own arrangements. Lots of improvements around walking distances and reducing defects, and also information for patients and family as well. Really important part of it. We can focus on process and just reducing our time, but actually that communication for staff, for patients and their family is really important. So one of the rapid improvement workshops had a little bit of a focus on how we communicate, and does the patient and family always know what's happening to them. So we're fortunate enough to have the opportunity to put together a short video on our sepsis value stream, which we're just going to run through now for you.
Welcome to Shrewsbury Town Football Club. On match days, 10,000 people sit here. Imagine more than 4 football stadiums, 44,000 people. That's the number of people who die every year from sepsis in the United Kingdom. Sepsis is an overwhelming inflammation and infection that affects the whole body. Too many people die of sepsis in the United Kingdom.
It could be me.
It could be you.
It was my dad.
It's because of cases like that our relationship with the Virginia Mason Institute has been so important to our organisation and the patients that we serve. The diagnosis of sepsis is a complex area, and it's really important that our patients are identified at the earliest point in arriving at the hospital. That then needs to be followed up by the delivery of the treatment bundle within 60 minutes of that arrival. These two areas are absolutely crucial in terms of the delivery of safe care for patients with sepsis. The power of this process is that it's led by the staff, releasing them from their clinical duties in order that they can come up with the solutions themselves and implement them with the teams in the various clinical environments where sepsis patients can present. What we're seeing is all these great ideas are coming from the shop floor. The examples of the ideas that they've had are to create trolleys, attaching drip stands, ensuring that the amount of walking that they're doing that minimises the opportunities for errors are being reduced. Simple, what might appear to be obvious solutions, this is the power of the process, and it inevitably will save lives.
The process that we're undertaking in our partnership with Virginia Mason Institute is to transform care by observing the care that happens in real time on the wards for several weeks, and then describing that in various tools to the staff. So what we've been able to do is run rapid process improvement weeks, which are workshops that allow the staff protected time to generate ideas, to test them, and then to implement those that really work, and they then become the standard work for us. They were able to reduce the sepsis process from over 7 hours down to under 2 hours, and delivering all the 6 elements of the sepsis bundle well within the recommended hour. In fact, they did it in 23 minutes. It costs less because we're not overstocking, making mistakes, having things done in a timely manner, or having to repeat processes. And it's also about the patient experience and the staff experience. So you've got those service elements, those financial elements, but also, importantly, safety, quality and experience.
As a result of this rapid process improvement workshop, we have developed many tools to help the septic patient, including the decision referral tool, the ward clerk tool, and also the education booklets for staff. Also being developed is a sepsis trolley to provide safe and effective treatment to the septic patient. As a result of this process, it's become easier for staff to spot the subtle signs of sepsis. For example, the increasing temperature, the increasing heart rate, and all these symptoms combined can result in sepsis, and it's much easier now for staff to spot those and act on them quickly. That means that every patient will receive a standardised care throughout the hospital, and they will be treated for sepsis in a more timely fashion, which can potentially save their life.
My dad, unfortunately, has had sepsis 4 times. Fortunately, he's one of the lucky people that is still here today. Thanks to the hospital, the staff and the nurses, in Shrewsbury. He did go on to make a full recovery, but it could have been a lot worse.
Myself, the board and the executive, plus all the senior leadership team, are utterly committed to this process. This is the work, and this is going to make a difference and create a safer environment for all of our staff and the patients that we serve.
Being involved in this process, there's a lot of work involved, but it has made me feel empowered in my role as a nurse, that my ideas and the ideas of all my colleagues will be heard and will be acted upon.
Sepsis can kill.
Sepsis kills more patients than breast cancer, bowel cancer and prostate cancer combined.
We really didn't think Dad was going to make it, and I really did think that that was going to be the end. These improvements are just what we need.
Moving on to our recruitment value stream, what we found is it was taking around about 3 months to get somebody into the organisation from when we had a vacancy. So we were realising that we were losing staff to other organisations because of our processes weren't quick enough. So a couple of improvement events workshops that we've focused on so far is around approval process and also how we get some of the pre-employment checks carried out quickly and timely so we can get people started. Really has helped us reduce in some areas our reliance on temporary staff, and if we can find we can roll this out across other areas, that will be a significant benefit as well too. Our most recent improvement event focused on how long it's taking from when the advert closes to when we're informing candidates of whether they've been successful, and when the interview date is. Again, we're finding this was taking way too long, over 20 days, nearly 30 days to be informed of if they have an interview or not. What happens sometimes is that candidates are often applying for multiple jobs in multiple organisations, and other organisations getting in first. So we're finding that we have real difficulty with recruitment, and we're only making that worse with some of our processes, our internal processes from our recruiting managers across the organisation. So really helping them to find how we can reduce some of that waiting or the waste in the process, and helping our recruiting managers to recruit quicker and get people into posts in a more timely way. And then finally we have our ophthalmology value stream, our ophthalmology outpatient value stream. Again, this was chosen because we really need to focus on outpatients, seen as a significant area of our organisation, and ophthalmology sees one of the highest numbers of referrals into our trust. What we really wanted to see is a reduction in the amount of time it takes to get for patients to be seen in the clinic, and also the actual clinic process itself. Some of our patients who we see here, this is Lynn and Woody, who joined us on a week, one of our rapid improvement weeks, and our patients are telling us their experience during clinic is not very good, particularly for our poor sighted patients. They're not always aware of what is happening with them or for them in the clinic, and our processes aren't best set up to help them. So we wanted to make a difference to that. We also wanted to help our teams as well to understand what's the whole process look like. Historically we've worked in these silos where booking teams and clinic staff and other teams across the organisation don't necessarily understand each other's roles or the process involved for each other's roles. So actually we had a real inconsistency in knowledge around who does what. So bringing that together, so all staff and the booking staff and the clinic staff understand that the whole process is making a big difference, because we each understand our own problems and our own pressures. What we'll do with this one, it was a really great opportunity to take the learning from this and apply this to other outpatient areas as well, not just ophthalmology. So a great learning opportunity for the ophthalmology outpatient value stream. I mentioned before about our Lean for Leaders course. This is a really great way to share the work and really empower our leaders across the organisation to take the methodology forward. So it's been really successful so far. We're on our second second cohort. So once we finish this one, they'll take us up to just under 100 members of staff across the organisation who've had a deep training in the Transforming Care methodology, Transforming Care Production System methodology. The course it takes 6 months to deliver. It's about six sessions over 6 months. And the way this is different from other courses is that the learning tends to take place in between the sessions. So the candidates come along, the participants come along, and they'll attend a one-day session and then go away and test out their learning in their own areas. So this is a great way of putting into practice some of their learning. And now they're learning some really deep techniques in lean transformation, which will support the rollout and the embedding of the work across the trust. So all these leaders in their own areas, from right across the trust, from recruitment, from finance to ward areas, clinic areas, therapies, many areas, IT, libraries, right across the organisation at every level. Our recent cohort, we have members of the executive team and senior consultants and medical directors. So right across the organisation. We have our leaders on the course, and for me this is probably the richest group of staff which will take the work forward. This will be the so really buying into the methodology, delivering the course, which is a really complicated, deep understanding of lean methodology course, and they'll help them to continue that forward in their own areas. So for me, probably the lean leaders will be our champions across the trust, helping to spread the learning. And if they can work with one or two people in their own areas and enthuse those, that helps that spread as well. So we have this current cohort going. We'll do ongoing cohorts, and these will lead on to the members from these groups will be able to go on and start to run their own rapid improvement weeks, and maybe go on to do advanced lean training, which is the next stage up. And as we roll this work out, it is really about how we apply all this learning through our lean leaders, through our methodology training days, through our value streams. And there's multiple ways of doing that. So right across the organisation now, as we speak, there are rapid process improvement workshops taking place. We have training and methodology training days where anybody from any area of the trust can come along and do a one-day methodology course, where we give them an understanding of how to capture that true current state of a process and do some remeasurement. And what they do is they'll go away and try that out, and then come back and tell us how they've got on. We've already talked about how we develop the value streams and how we pull people together to do that. This really is about not just the senior leaders of the organisation, but actually the people across the organisation to developing those value streams. And once you've identified the value streams, whole groups of people are engaged in identifying where our focus of attention would be, focusing on what does good look like, what does our ideal process look like. Again, a really good understanding of what we currently do, and then being really clear about where we need to get to in the future. So we hold our sponsored development days, which are groups of 30 to 40 people in a room to help us identify where our focus of attention should be. And then on an ongoing basis, day to day, we have regular Gemba walks and celebrating success. These are going out to those areas that have either had improvement events already or are due to have improvement events, and really recognising and celebrating the success which they've delivered, seeing how those have been sustained in those areas that we've been to some time ago. What we've seen is that over 3, 4, 5, 6 months, some of those changes have been sustained. And what we aren't great at in the past is celebrating those successes. So we are really focused on a programme of senior leaders and other members of the organisation going out to the Gemba to see for themselves that those improvements, and to see how they've been sustained, and celebrating those successes with the teams on the front line. Because as we've found, is the real power in this work is when you involve teams, you involve staff, they do come up with the ideas themselves. It isn't about a top-down initiative that's been delivered or the solutions identified in a workshop or a committee. These are the staff on the front line identifying the problems for themselves. So really is empowering those teams. We always say those people that do the work should be able to improve the work. We believe that everyone should have two jobs eventually. One is to do the job, and then secondly is to improve the job. and we can only get this groundswell of support, which I mentioned before, this bottom-up approach to transformation, if we engage our teams and encourage them, enthuse them to take part, and believe that if they offer a suggestion and they want to put ideas forward, that they'll be listened to. And this really fits into this principle of having those requirements for methodology, that having one improvement method, the one, it doesn't matter which one it is, just have one. Decide on the methodology, and I believe that's what we have done. We have recognised that we've taken the Virginia Mason production system as our methodology and translated it into our world, into South and into Shropshire. And these require a number of technical and human dimensions of change. So using tools, using techniques is really only one part of it. So the technical aspects, yes, it's the tools, it's the measurement, it's the program of work, but then there's the cultural side of it, those human dimensions of change, and that really is around the bottom four oblongs there. You can see that visible and committed leadership, that recognition that actually this is the way we're going to do things. We truly want to understand what's happening, and a sort of a no blame culture where we truly want to understand the current state of a problem so we can help to resolve it. Really creating a sense of urgency if there's a problem, let's get it resolved quickly. Let's not just organise another meeting which will wait for 4 or 5 weeks for that to take place. We need to get, if there's a problem, if there's error or defect for the patient, we need to resolve this quickly and get to the root cause of the problem. And often we do that by creating that shared vision, that, so what does good look like? Where do we want to get to? What are we all working towards? So what we often do with our value streams particularly is identify, as I mentioned before, about what's the ideal state, where should we get to, and that will be and we agree that's our shared vision that we're all going to work to. But also as an organisation, the executive team and the guiding team are being really clear about where it is that we need to get to. As an organisation, where do we want to be? So that's creating that shared vision, but also being really clear about managing expectations, that it's not going to be solved overnight. It's not a 3-month project. It's going to take some time. So actually we are in this for the long haul. So you manage those expectations both long term and short term. So you've been really clear about what the boundaries are if you're going to do some improvement work, and also what you're asking people to do. So that helps to develop that shared vision also, but also about people know what's expected of them and what they know, what they need to do to deliver those changes. So these really all do feed into that one improvement method. So as I said before, it doesn't really matter which one you choose as any organisation, just choose one, and it's shown to be successful. We've tended to use the learning we've had from Virginia Mason, which is very much based on 2 particular principles, Kotter and the Institute for Healthcare Institutions model for improvement. So Kotter really does talk about that creating a sense of urgency, building the guiding team, getting the message right, shared vision, empowering people for action, getting the communication right, really focusing on those short-term wins. Let's get those short-term wins. Let's convince people that actually they can make a difference, and then don't let up. Really, really important is the last 2 there: implementing and sustaining change. Energy will waver. You will run out of enthusiasm after a short while, but you do have to make it stick. You do have to see it through. It isn't a short-term fix. So you need that shared vision. You need that clear goal of where you're going to help you see those changes through, so it doesn't become a short-term 3-month project which runs out of steam. Actually, these things take some time. What we're finding with our value streams is that over 12 months later, we've still got a lot more work to do on them. We are going just picking at the surface to start off with, and then getting deeper and deeper into the problem, and that takes time to work itself through. So it isn't a short-term fix. And then the model for improvement really is the basis, strong basis for all our improvement work. So really being clear about what it is we're trying to achieve. What is the improvement? What do we want to deliver as part of this work? How will we know that a change is an improvement? Using measurement is a strong part of the methodology. How do we know how we currently do? Not just based on one person's opinion or another person's opinion, but by actually measuring and getting a true understanding of the current state. And then what changes can we find out that will result in improvement? Well, these are the ideas that we'll throw out there. These often come through workshops or through improvement weeks, but can be generated anyway, really, through our teams. What are those ideas that will make an improvement? And then you're using the Plan, Do, Study, Act, the PDSA cycle, to test out those ideas in a truly scientific methodology. This is a number of hypotheses that we create and test out to see if they work or not. Not jump into a solution to think that's definitely going to work, but actually coming up with an idea, testing it through the Plan, Do, Study, Act cycle, and seeing which ones work and which ones don't. Historically, what we've found in some cases is that ideas are put into place. They haven't remeasured, and we haven't done any sort of review on that change to see if it's actually made any difference or not. And sometimes things have actually made things worse, but we don't go back and review that and act on those changes. So the Plan, Do, Study, Act cycle is the basis for all the work. It can be either large scale or small scale. Large scale value streams are based on a whole PDSA cycle, but also individual ideas are based on a PDSA cycle as well. And this sits really well with a lot of our teams because they respect and value the scientific approach to the work, that it isn't just a random solutionizing approach to improvement. It's actually based on a let's test these ideas out, let's create a team of experimentalists to see if these ideas, often during 1 week or a 1 week workshop, we're testing lots and lots of ideas out to see if they can make any difference. And really it's around sort of questioning the normal, not accepting the status quo, that actually, we just need some of those ideas. We're asking people to sort of push the boundaries. It isn't really going to be, we're just slightly improving what we've already done. Actually, some of those fundamental changes that we've made over the past 12 months or so have been from ideas that actually are pushing the boundaries of normality. It's, some of those radicals out there really are offering suggestions which aren't based on normal existing processes. So we have to question everything. We have to question: are our current processes set up for us, or are they set up for our patients? And often we find they're set up for us. So actually, we want to actively disrupt a little bit of the status quo to challenge and to rock the boat a little bit. And one of the things we often find is people ask, are we allowed to do that? And with the guiding team that we have in place, with the team of executives, of course, yes, we have that permission. We're often told, try it out, be safe, but try it out. If it works, we'll keep it. If it doesn't, we'll get rid of it. So sometimes we are a little bit hamstrung by the previous culture of looking up to be told what to do next and asking for permission. And what this process and this methodology gives us is the opportunity for staff just to feel they can get on and try something out. And if it works, it'll stay. And if it doesn't, they can get rid of it. And that's quite powerful when you see a team of staff who feel they can do that. So the story of our work so far really has culminated in a number of really key statistics that we have available to us. Over 50,000 patient journeys are safer and kinder as a result of the work. This is through all our value streams, and it shows the commitment to keeping the patient and the family at the heart of everything we do. Over 3,000 miles less walking for our staff. This is having a huge impact. This is ensuring our staff are with our patients where they want to be, not having to go and find equipment or stock, and keeping everything close by, so more time will be spent on patient care rather than walking around trying to find things. Over 1,900 staff are educated in the Transform Care production system. So this is a deep level of knowledge across. That's over a fifth of the organisation who have an understanding of the methodology. This is a great foundation to build on over the next 4 years. And over 400 staff are using the Transform Care production system tools in their work. Either they are Lean for Leaders, or they are been through methodology training days, or they've been through rapid improvement weeks and they continue to use the tools which they've learned. Over 160 people who've come through our training days are using some of the tools with just everyday work, everyday Kaizen activities, just small incremental changes. Are they using 5S as a methodology to keep their storerooms tidy or their ward corridors tidy, or using mistake proofing, or carrying out waste walks regularly, or even just taken involved in Gemba walks. And we have over 80 lean leaders on track to deliver the Transforming Care production system in their own areas. That's right across the organisation, as we detailed before, and they start to really embed in their own areas, working with their own teams, inspiring new people to get involved and to use the tools themselves. So to conclude this session, we'll just cover off next steps, and that really is about how we take the learning from the last 12 months or so and roll this out across the organisation. A lot of the changes that we've made have been tested out in small areas. It's how we can scale that up and share that with all other teams where it's applicable. That will be a challenge for us over the next 6 to 12 months about how we can do that, and we're already seeing that in a number of areas, particularly in our sepsis and our respiratory value streams, where other teams are looking to implement the changes that have already been made. So that's great to see. We'll continue to identify our next value streams, and our guidance team will be looking at that shortly, about our next 3 to 4 value streams that as an organisation we should work on. And we'll start to continue our training for our advanced lean training cohort, which begins this summer, end of the summer, where we'll be training our own people to run their own workshops and take the roles of facilitators of rapid process improvement workshops across the trust. And that really will ramp up the opportunities there, and not solely reliant on the KPO team to deliver those. That'll make a massive difference. Overall, it's continued learning. It's learning where we need to go next. This is a learning journey and doesn't stop just because we've achieved some small wins. So I would say that our next steps is to continue that journey. We know where we want to get to, but we don't know exactly how we're going to get there. So we'll continue to test those ideas out to uncover new opportunities, and so we can ensure that we continue to add value for our patients and our staff as we continue our journey with Virginia Mason. That concludes this session. I'll look forward to speaking to you soon. Our webinar series will take place with the next subject over the next few months, and we'll hopefully deliver these every 3 to 4 months. Thank you very much.
Thank you for joining the first webinar in this series from SATH KPO. Please remember to join our live tweet chat on Thursday the 22nd of June at 3 p.m. if you have any questions, or alternatively, please contact us in the KPO team via our email kpo@sath.nhs.uk. Thank you.